Hello, 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 Facebook. Oh, my pen. Oh, sorry. I'm Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I am coming on tonight to talk about breast reductions. Hello, Miss Eva. Hello, Brandy. I'm looking around because I brought a notebook and a pen over here. Oh, there's my pen. Because I know I'll probably end up drawing some stuff, and when I went live, I grabbed up my notebook and didn't see my pen. So I had a request on Facebook and YouTube to talk about breast reduction. So I'm not live on YouTube, but I will share this to YouTube. So for the YouTubers watching this after I share it, hello. Hi, Tina, Loretta, Cherie, Shawana, hello, hello. Hi, Sabrina. Hi, Cindy. Hi, Lisa. Everyone, if you could do me thanks, Toya. If you could do me a favor and share the video. Share, share, share. Also, while I give people a little bit of time to log on, one great thing that's happening tomorrow, there's going to be a special on BET tomorrow night. I think it's called the Deadly Curves. And it's a documentary showing one woman's journey. I think it's one woman that's being featured on the show. One woman's journey after having, I believe she had illegal injections into her butt. And actually it's not one woman, because I think I saw some other people who were talking on the show. So it's basically gonna go over some of the things that people go through after they get illegal plastic surgery procedures. Killer curves, that's what it's called. Thanks, Ebony. My publicist, of course, she knew the right thing to say. I'm like, deadly curves, killer curves. So it's killer curves, yes. And so they're going to be talking about some of the bad things that happen to people who made the decision to get kind of back alley plastic surgery procedures. And there's going to be a watch party tomorrow, and there will be a panel of me, another plastic surgeon, and some ladies who have gone through that issue of having back alley type of procedures done, and their stories and journeys dealing with that, and some of the ways they were feeling emotionally that led them to make those decisions. And they basically, at this point, these ladies want to help other people from being hurt in the same way. So I'm one of the panelists, so look out for that tomorrow. I'm pretty sure, I don't know if I'll be allowed to or not, but if I'm allowed to real time, I will have someone go live or something like that. But I can't promise that. I don't know if they'll allow me to do that or not. But anyway, so yes, so that's tomorrow. So look out for that. And tonight, yes, Sabrina. Now, this is something, this type of thing, just kind of like safety and safe surgery, is something that I'm very passionate about. And I've been talking about this for a few years now. People were annoyed, like I was like Debbie Downer or something, when I would be trying to talk about this stuff and shed light on these things. And it's not to stop people from getting procedures, because I'm obviously not anti-plastic surgery, because I'm a plastic surgeon. It's just I don't want people to put themselves in dangerous situations to get it. And I think that when people are desperate to look a certain way, the issue is not their appearance. If you are willing to put everything on the line to look a certain way, the issue is inside, and I feel like there's more that needs to be dealt with before you get any procedures. If you're, willing to do, like, go into a hotel room and get a plastic surgery procedure. If I wanted to do your plastic surgery in a hotel room and I'm a plastic surgeon, you should be like, I don't think so. You know what I mean? So if it's a person who's not a medical professional, who's not a doctor, I'm not even going to say medical professional, because a nurse is a medical professional and a nurse shouldn't be doing your surgery. So if it's not a plastic surgeon and it's not happening in a safe facility, you shouldn't be doing it, period. But you'd be surprised at the stuff people do. And I think that the issue is inside. Well, I don't think it, I know the issue's inside, because if you are happy with yourself on the inside, even if it's something on the outside you don't like, you're not going to put your life in danger to get it. it's what they are portraying on magazines and TV. You're right, but to me that shouldn't matter. Like, I see all kind of stuff on magazines and TV, and I'm not going to be like, well, let me just die so I can look like Kim Kardashian. You know, or let me just go in this hotel room and let this hairstylist, this hairdresser inject stuff into my butt so I can have a big butt like Nicki Minaj. I don't care what they put in the magazine. I'm not going to die just to get it. So I still think people always want to put the blame on other people, and we're grown-ups. And so you have to look at yourself and say, why am I so desperate for this? What's wrong? What do I need to handle? Like, people always want to blame somebody else. It's not the media's fault. It's our fault if we are not paying attention to ourselves enough to realize that there's an issue when you're trying to do something that is dangerous. If you don't have some sort of thought like, I can't believe I'm going into a hotel room to let this random person who's not a doctor or a nurse or anything inject whatever they got in this Deer Park water bottle, like, I'm going to let them inject this into my body in this hotel room on top of this table. Like, you know, if you're not, that's not the media's fault. Can't blame it on other people. People have to take ownership and self-assess. So, I'm not one, I almost never blame other people for stuff that's going on in my life. Sometimes I should probably, but I always look at myself first, because usually the things that are going on in our lives tends to happen. It happens in cycles, and people, just like you'll date a certain guy and then y'all break up, it's all this drama, and then you start dating somebody else and you end up with the same type of drama you had with the last guy and then the next guy, because it's something that's going on inside of you that's attracting a certain thing. So we all need to especially when you're dealing with getting procedures to change your appearance, we all need to be doing some self-reflection and self-checking to make sure we're doing it for the right reasons and we're not desperate and we're not trying to do it to fix something else that's on the inside, because you won't be able to fix it. Hey, Myla Domino Britt, girl, nice name, girl. Is your last name Britt? Because then we have the same initials. My middle name doesn't have a D in it, but still. Hey, girl. Anyway, so yes, so that's not what I'm supposed to be talking about tonight, but you know I always do that, kind of just go off on tangents. But yes, check yourself. That's what people need to do. Don't blame somebody else because your self-esteem is so low that you go into a hotel room to get plastic surgery from a person who's not a doctor. Can't blame the person. You got to blame yourself for that. And figure out what needs to be addressed, and then address it. Like, we all have stuff that we need to address. We should always be aspiring to be better. Each day we should be aspiring to be a better person than we were the day before. So this is not me talking down on you. I have stuff in myself that I'm working on every day. So like, that's why when things go wrong or people wrong me or whatever, even if I know that they did something wrong, I'm still always saying, what could I have done in this situation to save myself from this? Did I do something to attract this? You know, I'm always thinking about that, because it's easy to blame other people, but when you do that, there's no growth. So, and in the case of this plastic surgery stuff, it could be a life or death decision to check yourself. You check yourself, you could save your life, literally. So, anyway, after all that, after you check yourself, if you need a breast reduction, then I'm going to talk to you about what to expect with that. So like I said, it was a few people who requested that I talk about breast reductions. So there's a few ways that a breast reduction can be done. Some of the reasons people want or need breast reductions, they'll have pain in their shoulders. They may be having pain in their neck or back from their large breast. They may get rashes underneath the breast, like in the folds, like where the skin of the breast and the skin of your upper abdomen meet. They might get rashes there. Difficult to get bras that work, make it difficult to exercise, all those types of things. For that reason, breast reductions is one of the procedures that we do in plastic surgery that can be covered by insurance if the person you choose to do the surgery takes insurance. There are guidelines to get it covered, and each insurance company has their own set of guidelines that they go by. There's often going to, like, first of all, you got to get a history and physical by a plastic surgeon, and they have to document that you have certain signs and symptoms from the enlarged breast. Physical exam has to be done, and including your height and weight, and oftentimes based on your body mass index or BMI, which is calculated from your height and weight. The insurance companies will say, okay, for a person of this frame, their bra size needs to be this, and they need to have this much weight removed in order for us to cover it. So you have to go through those channels if you are trying to get it covered by insurance. Now, there's pros and cons to that. So since the insurance company requires a certain amount to need to be removed in order to consider it a medical necessity, sometimes if a person is not that big to begin with and they just make the cutoff that the insurance company will cover, and they don't want to end up small, the insurance company might be requiring the surgeon to take off so much that the person ends up with smaller breasts than they want. So oftentimes, women who get breast reduction, sometimes they'll come in and be like, cut them all off, I don't want none of it. Sometimes that's what they say, but sometimes, a lot of times, they don't want to be flat-chested, because if you go your whole life with huge breasts, a lot of times the ladies will feel kind of off if they're too small. So if you're not trying to get a big change in the size of your breast, then it can get kind of sticky if you try to get insurance to cover it. Now, you would think, oh, well, just if insurance don't cover it, then I'll pay for it after the fact. Well, that's kind of a problem, because most hospitals have special rates worked out with plastic surgeons for OR and anesthesia time for cosmetic procedures. So once you go down the reconstructive track or medical necessity track where insurance is going to cover it, the price point is different for the OR and anesthesia time, and it's such a major difference. So I remember one patient that I did a breast lift on, which is the same. A breast lift is the same surgery as a breast reduction. You just take less tissue. So if you don't take enough tissue off, the insurance company will consider it a breast lift, even though the breasts are smaller. It's considered a breast lift. So anyway, this particular patient, she was a cosmetic patient, but somehow the hospital got it confused, and she got a bill as if she was an insurance patient, and her OR anesthesia fees were like $40,000. And $40,000 is not the price it would be if you start off out the gate as a cosmetic patient. It's a fraction of that. So it's important to have that distinction before you go into surgery. If you're just like, oh, well, I'll just try to charge my insurance. If they don't cover it, then I'll just change it later. It's not that simple. You'll end up with a bill for $40,000. Anybody got time for that, for breast reduction? So if you're coming to me, it's real simple, because I don't take insurance, so we wouldn't even be having to worry about that anyway. So yes, breast reduction is one of the procedures that can get covered by insurance, but depending on the surgeon you choose, it still may not be covered by insurance if you want a particular surgeon. How do you keep the size but perk them up? So that's a breast lift. So if you want to keep the same size and just have your nipple raised and your breast tissue brought back up to the position it's supposed to be, then that's considered a breast lift, and that's never covered by surgery. So there's a few different methods for doing breast reductions, and for the stuff that you guys can see. So there's a few different scar patterns that are possible. And for the most part, if you are getting a breast reduction and it's truly a breast reduction, it's really just one scar pattern that's possible. The different scar patterns is really more relevant if we're talking about a lift. And remember, I told you that a lift and a reduction are essentially the same surgery. It's just a breast reduction, you take out more tissue, but it's the same incisions and stuff. The incisions for a breast reduction is like this. You see that? It looks like an anchor. So the circle is around the nipple. The line, the vertical line is, from the nipple down to your inframammary fold, and then the other line is your inframammary fold. So you have a fair amount of incision on your breast getting a breast reduction. So that's important, because if you have skin that naturally keloids or something like that, you might want to consider if you want to risk having a keloid in this scar pattern. That will be kind of a problem on your breast. If you're getting a lift, you know, that's the same scar pattern. The other options for breast lift from a scar pattern standpoint is the lollipop incision, and then there's one where it's just around the nipple. Those are the 3 scar patterns. This lift here, hold on. This is a small lift, this is a medium lift, this is a large lift. If you're doing if you have large breasts and a lot of skin that needs to be removed, or even if your breasts aren't that large but you have a lot of skin, like say they're super duper saggy, you can't get away with this one. This is out. This is for somebody who needs a minor lift. If you don't have an insane amount of skin, you can get away with this one sometimes. So that's a person whose breasts aren't large. But if you have large breasts or they're really long, this is the incision that you have to have right here. Taking this incision away is really pointless, because you don't, I mean, doing this, I don't do this one very often, because this is you can't see this incision. Like, this is hidden in the inframammary fold. So from the naked, like looking at the person face on, these two will look the same. Like if you're on a nude beach, these two will look the same, because this one is hidden underneath this incision right here. But this incision right here allows for better shape of the breast. So if they can't get this one, I usually just do this one. So I wanted to have a breast reduction since I was 17. I'm about to be 33, 2 kids, and I'm so ready for them to go. Are you done having kids? Can you lift without a reduction? Yes, you can. So most of the time with breast lift, a little bit of breast tissue is taken out, but it's usually, if you want to be the same size, we would just take the breast tissue that's removed is removed in order to, sorry, I'm not that sleepy. I don't know why I'm yawning, but that was a big yawn. The breast tissue that's usually removed, if it's just a lift, is not enough to make a difference in your bra size. It's more to allow for movement of the tissue. So, yeah. I actually don't. So Jackie Henry said, how much lift is realistic in inches? Most stuff in medical terms is done in centimeters. So I can't answer that, because I don't have a good firm grasp on inches, because we don't use inches in medicine. From a centimeter standpoint, we can lift it a lot. Like, I mean, if there's a patient with a sternal notch, this is your sternal notch. So we measure from it's like a little groove right here in the center of your neck, right there. It's called your sternal notch. And so we'll measure from your sternal notch to your nipple. And the sternal notch to nipple distance, what is considered a normal breast should be like 20 centimeters or so, 21 centimeters or so. A person who needs a breast reduction or a lift, their sternal notch to nipple distance might be 30, or when they're really huge, it might be 35. And we can get it up to 20 something. So you can get 10 centimeters off, like get it up 10 centimeters or more. It's really not, we can get them up really high. I want body contour by you, but at the same time it's reduction, so I can't since you don't take insurance. That's correct, you can't, because I don't take insurance. The only option is to pay for your breast reduction, which I do have ladies that do that. Because you only get one shot to get it done right. And yeah. How long is the final result for a tummy tuck? How long, I don't understand the question. How long before you get to the final result? Or how long does the final result last? The final result lasts forever as long as you keep your weight stable. you have evolution of your result for probably up to a year, but the majority of the evolution happens in the first few months after the procedure. And what I mean by that is like the swelling and stuff like that, and the scar. The scar definitely evolves for a year to 18 months after the surgery. So absolutely. So Nans Dio asks, can someone get a lift without implants? Yes, absolutely. An implant is not required to get a lift at all. Is the fat underarm addressed during a lift? No, that's a separate thing. It can be addressed at the same time, but that's separate. Like, that's another procedure. So things like that, when you're talking to your surgeon, you should bring it up, because that happens a lot where people be like, well, I got it and I still got this over here. Well, this over here is not your breast. And so if the person doesn't address that, and they'll be like, well, they didn't do a good job because I still got all this. You still have all that because this is not your breast. That's an axillary roll. So you have to be clear about the things that you want so that you can get quoted for the right thing. Insurance is not going to cover the removal of your axillary roll, so that would be an additional cost. Absolutely. Rosemary, I do not take care credit. I hate care credit. Sorry. Don't take it. I take Alpheon, United Medical Credit, and Lending USA for people who need medical financing. I also have, I wouldn't really call it financing, but it's not financing because you have to be paid in full before surgery, but I do offer payment plans for people. But you have to be paid in full before surgery. So if you want to be paying toward a surgery, you can, directly to my office, you can do that, but you don't get your surgery till it's all paid in full. Yes. What about the fat under the armpit? Somebody just asked me that. Stephanie, you must have just got on. So the fat under the armpit will be addressed if you tell the surgeon that you want your fat under the armpit addressed, because that's not part of a breast reduction. That's not. A breast reduction is the breast. And if you got stuff going on over here, that's something else, and you just need to tell the surgeon that in your consultation so they can quote you appropriately. So some of the things that you run the risk of happening from a complication standpoint related to breast reductions. The biggest one I would say that needs to be talked about is the risk of necrosis to the nipple. So the larger your breast is, the greater your risk for issues with the nipple surviving. So those ladies who they have a sternal notch to nipple distance of like 39 or 40 or something like that, that means their nipple is way, way displaced from where it should be, and it has a long way to go to get back up to the chest wall. So that's people with really large pendulous breasts. They have a higher risk of the nipple not surviving the operation. And so that's something that needs to be talked about with the patient beforehand, because that is a real risk. The other risk is loss of sensation to your nipple. So for most women with large breasts who get a breast reduction, they usually don't lose sensation, although they can. What usually happens is they get better sensation, because the bigger your breasts are and the more pendulous they are, it's like pulling on the nerves, and so then the nerves just kind of like, it dulls the sensation that the nerve can sense. So when the nerve is brought back up to where it's supposed to be and all that tension is taken off of it, it kind of wakes back up, and a lot of times the women will have more sensation. So partial or total necrosis of the nipple is a risk for breast reduction. Loss of sensation to the nipple is a risk of breast reduction. Asymmetry is a risk of breast reduction. So most of you guys know that a woman's two breasts are not exactly the same. A lot of times there's a difference in size of the two. The nipple will be, like when I take measurements, it's rarely exactly the same distance. Sternal notch to nipple distance for each side is usually off by like a half a centimeter or a centimeter difference. The inframammary fold can be at different levels on each side. So after the surgery, asymmetry is possible because you start off asymmetric for most people. Bleeding, so like a hematoma or something like that, which a hematoma is like a big blood clot in the womb bed. Infection, obviously, you could get. But I would say the most devastating is too harsh of a word. I would say the most annoying is too minor of a word. I need something between annoying and devastating to describe what it's like to have part of your nipple not survive, or all of it. It doesn't happen often. One of the things that we will do if the person's breasts are super, like if they have mega breasts, like they're just really, 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 really large, is talk to them about grafting the nipple. So basically we would take it off and put it back on like a skin graft so that you have it there at the end. And that'll keep it from turning into a scab and actually dying if someone has really, someone's breasts are really large. But if you have normal sized breasts and you're just trying to get them lifted, then the necrosis of the nipple thing is much less likely to happen. It really happens in women with really, really, really gigantic breasts, like huge, like they look like the long watermelons, those big watermelons, not those little cute round ones. I'm talking about those huge ones. Like those are the type of women who tend to get that complication if it happens. Yes, Jackie, that's a good way to phrase it. Unpleasant outcome, yes. Since I hate the way my breast reduction looks, what can I do to get it fixed? My right side, he took too much out. It's hard to say without seeing you, but I can't really say how it could be fixed without seeing it. Hello, I have my implants removed and have a lift. I have keloids and the scarring still hurts. Can anything be done about it? You can have steroids injected into it. Silicone sheeting. Sorry, I said silicone sheeting. Scar creams, stuff like that can help with it. I used to want a reduction, but after losing 135 pounds, I'm left with big, sad, empty skin sacs. Would a lift help if I don't want implants? Yes, a lift will still help even without implants. Hi, Yvonne. Let's see. So I guess it looks like I answered all the questions. What else do I need to say about that? One of the, oh wait, let me see. See, Cynthia Taylor said, I didn't have any complications within there. Super sensitive now. Yes, that is very common for them to be much more sensitive. Oh, one thing that people will tend to complain about after they get a breast reduction, those are usually some of the happiest patients we have because the pain is resolved immediately that they have from having heavy breasts and stuff like that. But one of the things that they'll say, like when they come for follow-up, is like, oh, ever since my surgery, I noticed my belly's been bloated, how long is this going to be like that? And their belly is not bloated. It's that the breasts aren't sitting on it, and so now they can see it. And usually their belly is bigger than they realize. But now that the breasts aren't laying on it, they actually are able to see what their belly looks like. So I always warn my patients before I do the surgery to expect that, so that they're not thinking I'm just trying to make excuses, because they'll swear you did something to make their belly bigger. It's like, girl, all I did was operate on your boobs. Your belly being bigger has nothing to do with me. I didn't touch your belly. But they'll swear, ever since the surgery, I've been bloated. You're not bloated, baby. That's what you look like all along. You just couldn't see it because your breasts were laying on top of it. So that's a super common complaint or concern after a breast reduction. That's like one of the most common things people will say. Risk of a second. So if you get a second breast reduction, the biggest risk you have is loss of your nipple, death of the nipple. So especially if it was 16 years ago, it might be hard to get the op note from that surgeon, because we keep the nipple alive on something called a pedicle, and there's like many options for pedicle patterns. And so if the doctor doesn't know what pedicle the last doctor used, then it's kind of guesswork. And if you guess wrong, then the person will not have enough blood supply to their nipple, and then their nipple may not survive. So getting a second reduction increases your risk for loss of the nipple more than the risk you have getting it the first time. A breast reduction and revision, you can get a revision of any operation. What it would entail would vary from person to person. All my dark spots went away, including the indentations, within a month. That's really good. You heal well. Hey, Sade, my baby sister's on here. Chantilly Chanel, that's my sissy. Hey, Toya. What all is done in a mommy makeover? A mommy makeover, people always ask that, or they'll do an inquiry to my website and say, how much for a mommy makeover? It is impossible to answer that question because a mommy makeover is not the same surgery for everybody. It's basically a generic term for getting multiple procedures to restore your body after children. But it usually entails some sort of abdominal procedure with something else. So usually it's like, oh, they get a tummy tuck and a breast lift. That's called a mommy makeover. If they get liposuction of their abdomen and thigh lift and breast implants, that's a mommy makeover. Those are two completely different price points. So what your mommy makeover has included in it will determine what the price of it is. To keep the fullness, could I get a reduction with lift or lift with silicone implant? So a reduction and a lift is built into the reduction. So if you're getting a reduction, you're getting a lift. To restore fullness, you would add an implant to the mix. So you can get a lift with an implant, and that will get them up where they belong and put fullness back in the upper pole. Right, Sade, depending on the mommy. You too, Jennifer. You have a good night too. I did it twice. My sensation is weak. Yes, the more surgeries you do, the more times you get a breast reduction, the higher your risk profile is for everything. Do I have a starting price chart for what? Breast reductions? Or mommy makeovers? I'm located in Johns Creek, Georgia, which is a suburb of Atlanta. What happens when the final shape is flat and not round? You might need an implant. I'm not sure what your interpretation of flat is, but it might mean you need an implant if what I'm imagining is what you're talking about. Yvonne, that's not a weird question, and that's kind of a dicey thing. So the textbook answer is every time your implant comes out, a new one should go in. That's the textbook answer. Sometimes it doesn't go down like that, but it is definitely risky to reuse an implant. When the implant hits the air, the textbook answer is that it should be replaced with another one. For procedures, like all the procedures are different. So that's why, like, I don't just like post my prices. Like, I don't do that. So if somebody wants a quote, you have to get a consult. The only thing I really say is that lipo starts at 4,000 since I do so much lipo. But I haven't, and I definitely haven't memorized the price scales because I don't do that part of the consult, the money part. So for an arm lift, BMI needs to be 35 or less. I was a 38 and I have 38I, and I have, when I got my breast reduction, I was a 38B. Now I'm a 34. Did and still have sharp pain in my breast sometimes, and my arm swells up sometimes, and none of my doctor can tell me why it never happened before my surgery. That was a really confusing. You probably were typing fast because I'm the first 3 or 4 lines are really confusing to understand. So you were saying you were a 38I and now you're a B, so they took a lot of tissue off. Wait a minute, you're a 34. So a breast reduction shouldn't change the number. It should only change the cup. Yeah, you need to talk to your doctor about that stuff. Is it safe to get pregnant after a tummy tuck? Yes, you can get pregnant after a tummy tuck. It's not going to hurt you. When can the final results be seen for a lift? I would say 3 to 6 months. You'll see your final result. Well, but not from the scarring standpoint. The scars are under evolution for at least a year to 18 months. But the shape and stuff, usually it shapes out by 6 months out. Okay, y'all, I'm going to go ahead. I keep yawning. I'm going to go ahead and sign off. So, check me out tomorrow when I'm on the panel for Killer Curves. I have some really big things on the horizon, so just keep an eye on stuff. Share my video. Tell your friends about me. Follow me on Instagram. All that good stuff. What are your requirements for someone traveling for a tummy tuck? You have to be in town for 14 days after the surgery. I know you are from Ohio. Do you I don't recommend other doctors, sweetheart. The lift or the implant, they could end up being similar in pricing, the two. If you get both, that's more expensive. Okay. All right. So I am Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website at www.ederrabella.com, or you can call my office at 678-325-0006. All right. I'll talk to y'all later. Bye.